My name's Kenneth Quick. I'm a podiatrist. I specialize in foot and ankle surgery. I've been in practice in the Mandeville area for 23 years. Initially went into it after having an interest in engineering. There's a lot of mechanical correlations that the foot goes through in order to work appropriately, and when they don't, then you start having problems. Like podiatry, we treat people from infants all the way up to their late 90s. We do sports-related injuries, fractures, trauma. We do congenital corrective surgery, coalitions, and different type of maladies like that. So we can treat people from all age groups. And we typically are able to get a resolution pretty quick. So it's not anything that you have to go through for years or anything. Usually, within a couple months after surgery, people are back doing what they wanted to do in the first place. As a podiatrist, we see people that come in for bunions, hammer toes, heel pain is very frequent. A lot of sports-related injuries. People decide to start getting into shape and start having some problems. One of the more common ones with athletic people are ankle sprains. A lot of people will sprain their ankle, and if it doesn't hurt too bad, they'll just put ice on it and go back what they're doing. At best, most people will go to an emergency room and they'll get it x-rayed. At that point, if there's no fracture, the emergency room will typically give them a pair of crutches and say, just take it easy for another couple weeks. When they say they sprained it, what does that really mean? It means that you had to damage something in order to get the bruising and the swelling to occur, and that's usually tearing a ligament or a capsule. And as a result, now the function of that ligament is interrupted, so you no longer have the stability. So it's common for people to come in maybe 6 months or a year after they've injured themselves and gone to the emergency room and been told everything was okay, and they start having more ankle problems because they're twisting their ankles more, they have more pain because it's not as stable. We typically do an MRI, do some inter-office testing, and we can diagnose if the ligament was attenuated or stretched or torn. And there's different therapies to fix each of them. They have 3 ligaments on the outside of the ankle. The first one is the smallest and thinnest, and it's inside the capsule. A lot of people that get a lot of bruising afterwards have torn that one because it tears the capsule, resulting in the bleeding and the bruising. That one, if it's torn alone, 99% of the people will do well with physical therapy by itself. On the other hand, if you tear the first one and the second one, and you have to do them sequentially, you can't tear the second one without first injuring the first one. If you tear the first and the second, 99% of those people typically require surgery. And that involves replacing or reconstructing the ligaments. We can do that with their own tendons. There's even some new biological tissue that you can use to do such a procedure. Recovery is full, back to an active status, even better than it was before in most cases. I've got people that have played college ball afterwards, college basketball, football. I have a policeman that rides on a horse in New Orleans and jumped off and sprained his ankle. He's doing very well and returned to his job. So it's a gratifying procedure because the results are so good.